Hello guys, welcome back. Another topic we will discuss today, that is mental health issues for special population. So what is the special population? So that we will see who are all coming under this special population. Okay, so that we will see in this video. Special population means what? The population who needs some special care and attention, right? So that is the meaning of special. So the special population in mental health problem are children and adolescents, pregnant women, elderly people, victim of violence and abuse, HIV, AIDS affected people. So these are all the major special population. I mean the people, those who need some more attention comparing to common population. Okay, so we will see one by one. So first thing is elderly people. So what is the meaning of elderly? Those who have the age more than 60, that is considering as old age, right? So according to research across the globe, the population aging rapidly. Between 2015 and 2050, the proportion of elderly population is over 60 will nearly double. That means 12 means 22, so like double. So between 2015 to 2050, now we are in 2022, the proportion of elderly population over 60 years will be nearly double. So the elderly population's number is increasing day by day, and along with that their physical and mental health problems also increasing. And mental health issues, that one of the main issue we can see in elderly people, they are facing a number of lot of mental health issues, and some mental health issues are not getting not getting proper attention. Also some visible mental health problems only getting attention actually. Research is saying that around 50% of the adults aged over 60 and over suffer from different type of mental disorders. So what is the risk factors or reason of this elderly person's mental health issues? Life stress which they have undergone is the major reason behind these mental health problems. Then reduced mobility, because physical impairment will start. Physically they cannot perform all the activities like walking, jumping, dashing, hitting like a youngster, they cannot do. So their mobility will get reduced. You can imagine after getting a fracture, or you met with an accident, you got a fracture, and you are hospitalized and you are bedridden for 1 week. Imagine your situation, how you will feel. You will feel mad. When we can go out from this bed, when we can get up, when we can do the regular work, when we can come out, that feeling only will be there always in mind. Then imagine in the elderly period of the time, complete bedridden stage, reducing the mobility day by day, always asking support and taking support from others to even move to the toilet also, to do their daily activities, to do personal care activities. So these type of stresses can create mental health problems in elderly people. Then another factor is chronic pain. Pain will arise because of this physical impairment, physical problems. Then drop in socioeconomic status. Suddenly the socioeconomic status will drop due to retirement, loss of job, stopping job, etc. etc. So that is other reason behind this mental health issue. Then isolation and loneliness. So once you get older, automatically an isolation will develop, because young people, your children, your family members will be busy with the work. Because the son or daughter or the family head might be the breadwinner of the family, so they need to go out, they need to work, they will be busy with their education and their work. So you will not get a space along with them for a long time. You will not get time, and they don't get that much time along with the old person to spend. So it can create isolation and loneliness, and that is the other reason behind mental health issues in elderly people. Then physical health condition like heart problem, kidney problem, and other organs problem. Then elder abuse like physical, verbal, psychological, financial, and sexual abuses. Okay, so these are all the risk factors behind the mental health issues for elderly people. And the major mental health issues for the elderly people are dementia, depression, anxiety, PTSD, that means post-traumatic stress disorder, like trauma which they have undergone before, and that will come in the form of stress when they get old. Alzheimer's, schizophrenia, and neurological conditions. So these are all some of the major mental health issues which we can see in older people. While coming to the management, what management we can give to them means psychological support and emotional support. That is the major thing. Then develop age-friendly services. Based on their age, a friendly service we can create, because they cannot do and perform everything like a youngster. So develop an age-friendly services to provide maximum person-centered care to the person. Then health promotion strategies. You can take health promotion strategies depend upon the condition of the elderly person. They are not patients actually. They are just human beings, an individual and a person. Consider them like that and give health promotion to them. Then provide security and freedom. Security, that is one of the most important thing which you supposed to give to an elderly person, because they will literally feel they are not secured. They will always have that fearful stimuli in their mind. So provide security and freedom and social support, health and social awareness programs, prevent elder abuse, community development programs. These are all the some general and major things which you can provide under the management session of an elderly person to overcome their mental health issues. And apart from that, always person-centered, depend upon the person. Based on the patient or the person's likes and dislikes and the needs, we have to provide support. So among special population, elderly people are the one. Next, WHO, that is World Health Support. World Health Response or Support. World Health supports government and the goal of strengthening and promoting mental health in older adults and to integrate effective strategies into policies and plans. The comprehensive mental health action plans for 2013 to 2020 is a commitment by World Health Organization member states to take specific actions to promote mental well-being, prevent mental disorders and provide care, enhance recovery, promote human rights and reduce the mortality, morbidity and disabilities for persons with mental disorders, including older adults. So the objectives of this WHO response are strengthen effective leadership and governance for mental health, provide comprehensive, integrated and responsive mental health and social services in community-based setting. Community-based setting is important because the elderly people are always located in the community only. And implement strategies for promotion and prevention in mental health and strengthen information system, evidence and research for mental health support. So these are all the things. Then second group is pregnant women. Pregnancy is an exciting thing, an exciting time. At the same time, that is a very crucial stage for every woman life. So for every ladies, okay, pregnancy is an exciting thing only, but at the same time it is a risky and crucial stage also. Not every woman get affected with this pregnancy related mental health issues, but some of the people are getting affected depend upon their stage and the life status and the situation and surrounding. So what are all the changes we can see means in after pregnancy means becoming a mother, suddenly becoming a mother, stopping the work, daily schedule work what they were doing, that can create lot of mental issues. Then changes in the relationship, like husband wife relationship will be in different way after coming a baby. Then parenting confusions, then fear that the problems with pregnancies and baby care, then physical health problems, complications and fear of childbirth is one of the major problems, then lack of support. The research is saying that 1 in 5 women have mental health problems in pregnancy or after the birth of baby. So if you take 5 members, 1 person is having this problem. So that is the another special group people in mental health services and mental health area. And while coming to the management, of course, medication, food, rest and sleep. Then psychological therapies, talk therapies, emotional support, psychological support, meditations, yoga, and relaxation techniques. So the main thing is provide good food, good rest, good sleep, then relaxation techniques. So these things are very much effective to overcome the mental health problems related to pregnancy. So problems can develop during the time of pregnancy, during the time of childbirth, even after the birth of the baby. So we will discuss detailedly the mental health issues related to pregnancy in next video. So next type of special population is abused and violence people. So abuse might be physical, emotional, verbal, sexual. Okay, and it can have severe effect on mental health. Abuse can create lot of mental health problem. Physical abuse can create mental health problem. Emotional abuse can create mental health problem. Verbal and sexual abuse also can create mental health problem and the severe mental health problem, and it can damage the emotional and physical health of the person. So abuse is another especially concentrated area of mental health. Then violence and mental health. So the relationship between this violent and mental health is literally complex. So those who do violence have mental health problem, not everyone. But mental health associated violence are the specially concentrated area in mental health department. Schizophrenia like psychotic disorder are associated with aggressive and violent behavior, and dealing with violent mental health behavior or mental health problems or violence associated mental health problems is a complex task actually, even it is dangerous too, and violence can harm themselves and others. So violence and mental health relationship is literally complex, because those who do violence have mental health problem. Like that a question is asking means all the people those who are doing violence have mental health. No, not at all. But mental health problems associated violence are literally dangerous, and dealing with these people are also dangerous, and it can harm the life of the person as well as others. So this is another two special issues which we can see in mental health. Then preventing mental illness associated with violence. How you can prevent this violence means understand the problem and provide treatment. So if the problem is associated with psychotic problems, I mean the violence is associated with schizophrenia and psychotic conditions, means give treatment for that and encourage and support the people to access effective treatment. Always give treatment for the problem. Violence is not the problem there. Problem is schizophrenia, means give treatment for schizophrenia. Problem is emotional problem, anxiety disorder, and that is creating violence, means give treatment for anxiety disorder. So always focus on the problem and focus on the treatment of the problem. Then help to coping with aggressive and violent behavior. Help them to cope with the situation. How to overcome this aggressive behavior, and the therapist and the doctors can teach that. Then communicate in a calm, clear, and so slow voice. Those who do violence, okay, violence associated mental health problem means communicate them in a calm and clear and slow voice. That automatically it will get stick in their brain. Then give some physical space for them. Don't force and don't pressurize. Don't compel them to do something. Give some space for them to think. Let them think. Then have a plan always. A plan is very, very important. That's what I told you. Planning is very important. Plan-based treatment. The patient is showing violence, means don't give treatment for violence. Don't try to manage violence. Of course, you have to manage. We have to prevent violence. At the same time, you need a plan to give treatment for the problem. The problem might be schizophrenia. The problem might be attention deficit and hyperactivity disorder. The problem might be anxiety disorder. The problem might be some other psychiatric condition. So give treatment for that problem. So you need a plan always, and call the crisis team if the situation is under the control. I mean beyond the control, like it is not under control and it is beyond your hand, you're beyond your control, means always call the crisis team. So always an action plan is needed when you are dealing or when you're treating the people, those who are showing violent behavior and aggressive behavior. Then HIV and AIDS, that is other special populations which we can see in mental health issues. The HIV, human immunovirus, and what is AIDS? Acquired immune deficiency syndrome. Due to HIV virus, this immunity will you are impaired, you are getting an impairment in the immunity. Gradually you are affected with lot of other health problems, and that situation is known as AIDS, acquired immunodeficiency syndrome. Stress is the major mental health issue we can see in AIDS, because if you use your common sense, you can understand the reason. This life-threatening stage situation is going to take your life. That feeling can create stress, then mood, anxiety, cognitive disorders, then depression. So these are all the mental health issues we can see along with HIV and AIDS. And what treatment we can give for this means social support, psychological support, emotional support, and apart from that, major thing is HIV awareness program to the common person, like what it is, HIV is what, whether it is, how it will spread, and what is the reason. Yeah, if we give awareness to the common man, that person will support this HIV person. That person and that community will support the HIV person to overcome their problems, then help to deal with laws and avoid discrimination associated with HIV and AIDS, and provide a place for them to live their life. So these are all the management modalities we can see in the case of HIV or AIDS affected persons mental health problems, means related mental health problems. So these are all the special groups we can see, and one more group we can see, that is children and young people. Recent research is saying that 1 in 6 children affected with mental health problem, and 75% of the children and young people who are experiencing mental health issues are not getting proper treatment because they cannot express what is their problems. So prevention is always better than cure. So those who are having problem, or you are feeling or you are noticing something unusual with your child or young person, means you must be vigilant, and you must always take care of them in a special way. You must treat them in a special way, and always maintain good physical health, good food, regular exercise, freedom to play, allow them to being a part of family, allow them to communicate, check the academic performances, take them for outing, talk to them, communicate with them, allow them to explore their field. So these are all the things always you need to maintain to avoid the mental health problems in young children, because 75% of the children are not getting proper treatment. The reason is inability of inability to explain their problem. They can't explain this is their problem, and we will get confused with their problem, those who are watching. So if you feel something is unusual, definitely you need to talk to the doctor, and always maintain a good healthy environment for the children and young people to maintain their mental health, because that is the budding stage and growing stage, developmental stage. Okay, and common problems in children: depression, anxiety, ADHD, that is means attention deficit and hyperactivity disorder, self-harm, GAD, that means generalized anxiety disorder, PTSD, that means post-traumatic stress disorder, eating disorder, and mental health these are all the common mental health problems we can see in children. So these are all the special population in mental health department, mental health services and mental health area. And while coming to the management for this in children and children's mental health issues, means again the same thing, only therapy, psychotherapy, cognitive behavioral therapy to change the maladaptive behavior into adaptive behavior. You can use the operant and classical conditioning techniques, then family therapy and medication. So this is about the management. This is the generalized explanation of management. If we go to each disorder, mental health problems, childhood mental disorder, different treatment modalities will be there. So this is about the special populations, mental health services or mental health issues for special populations. So special population means the people, those who need some special care. The special population include children, young children, then elderly people, pregnant women, then HIV AIDS affected persons. Okay, so the violence affected, abused affected. Okay, so these are all the special population, and these group needs some special care, otherwise there are chances of severe hazard, severe complications. and once it happen, even sometimes you cannot even control also. So special populations care, mental health support and care and awareness program is one of the major thing which we can see in mental health department across the world. So I hope you understand, guys. Thank you.